How many things in veterinary medicine today are posed to us as a behavioral problem, which really aren't a behavioral problem, but a medical problem that really have some resolution through medical procedures?
We'll go back to the start of your discussion about when we graduated and how veterinary medicine has changed. And I think one of the biggest ones is the field of veterinary behavior, but not just to treat behavior problems, although that's important, not just to diagnose and save those pets from euthanasia. Another one that's a little bit more subtle is improving the human-animal bond in a family where the people aren't bringing their pet in for euthanasia, but they're not too pleased about the behaviors that are going on at home. And being a veterinarian who asks behavior questions, not only for all the behavioral reasons, but because behavioral signs are sometimes the first signs of medical problems. So that whole field of behavior, not just for helping the pet behaviorally, not just for improving the bond, not just because we have new drugs and medicines to reduce anxiety for the welfare of the pet to improve the problem, but also, number one on the list, you're a veterinarian who has to diagnose medical problems. You don't ask behavioral questions, you're going to miss behavioral diseases. And another big change is the identification, or at least name that we've given to this problem, called cognitive dysfunction syndrome. So that if your cat who was 12 years old and howling wasn't hypertensive, and didn't have hyperthyroidism, and didn't have renal failure, and didn't have ocular or ophthalmic or auditory problems, it could have been cognitive dysfunction. So they all play hand in hand. The answer specifically to your question is every single disease process that I can think of can often start with behavioral signs, and sometimes they only have behavioral signs. Take neurological disease. Sometimes, whether it's a tumor in the brain, whether it's a disease like hepatic encephalopathy, the signs might be behavioral, the way they interact with the owners, howling and vocalizing. Any urinary tract or disease that causes urine flow changes can have a house soiling presentation. A pet who is got a change in personality or temperament in some way. Any of those can be behavioral or medical. Take pain. Pain. You diagnose pain, other than gait, almost completely on the way that the pet acts behaviorally. Take sensory decline, cognitive dysfunction, all behavioral signs first. And then we have a whole group of disorders which are self-traumatic, like psychogenic alopecia, I'll use the broad name, or acrylic dermatitis in dogs. And in some studies that both myself and other dermatologists have done, a lot of those had food intolerances. A lot of those have allergic components. Some of them have cleared up simply with medical treatment. See, you've got to ask behavior questions. You've got to think it could be a behavioral problem, but you have to rule out the medical first.